If you are an Invisalign provider, orthodontist, or general dentist, you need to watch this video. This is one of the most common and maybe the most egregious mistake I see that will make a simple case lead to a problematic occlusion or an unending case. Here's a patient, class 1 bilaterally. There is crowding top and bottom. And you can see there is also some considerable wear. This woman is in her 20s and already she has a lot of wear. Her chief complaint is that she doesn't like that her teeth go in, and she wants to have her teeth kind of lean forward more, be more prominent. Now, I recognize, because I look at teeth on a computer and in real life every day for 30 years, I recognize that she doesn't have a lot of crowding. And so any forward movement of her teeth would lead to spacing beyond at least just a little bit of broadening to align. But at a certain point, you're going to start opening up spaces, and that might limit you. Same on the lower. So you can maybe expect a moderate forward movement of these teeth. In this case, I actually am explaining to the patient that she would be an excellent veneer candidate to protect her teeth given the extreme wear, and that would allow me to open her bite much more, not by opening the vertical dimension, but by proclining the teeth to open up space. But here's the mistake. Invisalign must have recognized that they wanted this patient to have nicer looking teeth in terms of the angulation. And this is what they provided. Now, if you look at this, that looks sort of more like what we want. And what's nice is, at least seemingly nice, is that we got that inclination that we would like without opening up any space. So in other words, here's where the patient started, and here's where the teeth seemingly improved in terms of the angulation, and you see there's no increase in space. But this is not a realistic movement, because what you have to look for and recognize is the leading edge of this tooth movement on the upper anteriors here is the palatal. Look at how the gingival margin on the palatal is moving more than the incisal edge. And you can check that also looking at it here in this view, and you'll see that the gingival margin from the buccal is going in more than the incisal edge. This is called lingual root torque. This means that the crowns are being held sort of in place, and there's a force that is pushing the roots back. Well, there's two problems with this. First of all, the roots are surrounded by bone, and the root doesn't go straight up. The root already has an acute bend called a column angle. The apices of those centrals are close to the cortical plate. And so this movement will not happen. It won't. What will happen is it will lead to side effects. Now, if you use braces and a rectangular wire, even in my opinion, that's tough to execute, but it's not going to happen with the aligners. The way you correct this and see actually where you stand would be to modify this clincheck by taking the lingual root torque out. Okay. Now you see how the central is coming forward in a tipping motion. I still have lingual root torque here that I don't want. So now I'm getting some alignment of the front teeth. I'm also going to take this out over here. I'm not really adding buccal root torque. I'm just putting the teeth at the root torque where they're at the start of the treatment. Now, I'm getting a little intrusion and I'm getting a little alignment. And this, to me, will not satisfy this patient's chief complaint, because their complaint was they want to show more teeth and have a fuller smile. And they don't want their teeth to lean in as much. So what I then will do is I will mock this up and I will show the patient what it would look like. Now watch what will happen to the arch circumference if I just add spacing between the teeth. Now, the patient may not want this spacing, but if they're willing to do restorations afterwards, it would work out Great. As an orthodontist, I don't look at everything like a tooth position problem. I look at things like a tooth shape issue. So now I have some anterior clearance to support and to allow for ceramic material to be placed without affecting the bite. These are no prep veneers. Now I have a simple Invisalign case with tooth tipping forward, creating spaces between the teeth, all ready to go for veneers at the end of the treatment.